What's up, everybody? Welcome to Sostento Live. We are live. You may hear some of the leaf blowers in the background here because they decided to show up right when we got started. You know, it is fall. But I just want to welcome everybody. If you're a frontline health worker and you're here with us today, let us know where you're joining us from. We want to know. I see that we've got Laquat, who was our special guest last time from the Ibn Sina Foundation in Houston, Texas. Hi, Laquat. Hope all is going well. We got Rachel from Ethne Health in Clarkston, Georgia. I know Ethne Health, they serve the most diverse square mile in America in Clarkston, Georgia. I got the really nice opportunity to meet them last year. And we've also got Bobby. Bobby is joining us from South Pittsburgh, Tennessee. Hey, Bobby, how you doing? If all of our health workers, if you're here, let us know where you're calling in from, where you're joining us from, so that we can shout you out. So excited to have you for this last Sostento Live of the year. So who else we got? Actually, I see Eileen from Sheep Health in Pittsburgh, Tennessee. Hey, Eileen, how you doing? Brooke Lowry, St. Clair Community Health in St. Clair, Alabama. I see you, St. Clair Community Health. I know you're doing quite a bit of amazing work. We see all of your COVID work in our data dashboard coming in. Our special guests from Open Arms Clinic are here. Welcome, Elkhorn, Wisconsin, right outside of Milwaukee. Our good friend Molly Stone from our earlier Sostento Live from the Medical Outreach Ministries. How you doing, Molly? Also ran an event with them last year. Awesome team over there. And then, of course, our original clinic, the first ever free and charitable clinic that Sostento ever worked with, the Good Samaritan Health Center in Atlanta. How you doing, Brianna? Hope you are well. Thank you for joining us. Also, Holly from Interfaith Dental in Nashville, Tennessee, another one that I met in the roadshow. They keep coming in. Our health workers are showing up. We're turning out for Burnout today together on Sostento Live. Karen from DuPage Health in just outside Chicago, Naperville. We got Stephanie. Welcome, Stephanie. Lake County Free Clinic in Ohio. Great to have you. We got Dan. Dan's also from Ethne Health. Oh, and I see Jody too. Jody, Hope Clinic in Austin, Texas. Love seeing you all here. Welcome, everyone. They keep coming in. Mary, hi, Mary. One of my favorite named clinics in the network, the Good News Clinic in Gainesville, Georgia. Hey, Mary, how you doing? Welcome. Welcome to Sostento Live. Welcome to all our health workers and other guests who have joined us. This is our third Sostento Live and our last one of the year. And we have decided today to focus on health worker burnout. So why did we choose burnout for our theme of the Sostento Live, and actually also for our end of year campaign? Why are we focusing on burnout? Well, actually over the summer, I started talking with different health workers and asking them about what should Sostento's end of year campaign should be. And they all talked about burnout with me. They all said, listen, burnout is a huge issue. We've been through over 2 years in the pandemic. We're tired, we're exhausted, and we need to do something about burnout. And my go-to when I was talking with the health workers was, okay, I know what we can do. We can raise some money and we can give you a spa day. Wouldn't you like that if we sent you to the spa for the day, or we gave you meals, maybe a lunch for the health workers? And I remember that every single health worker said, Joe, that is not what we need. That will not help us. That might make us feel good on the surface. But if you want to deal with our burnout, we need to go deeper. They said, we need you to do something that is not superficial about our burnout. We don't want to thank you. We don't want a round of applause. We want your help, Joe, in actually taking on the systemic issues that cause burnout at our clinics. And so after those conversations, I went back to the Sostento team. We kept listening, and we came up with something that we believe creates burnout among the health workers that we serve. So I'm going to show you this. We call it the burden cycle. And we talk about this at Sostento of a cycle that causes burnout among our health workers. And what it starts with is that our free and charitable clinics, we know you serve low resource populations that already have high health burden on them. That means when they come in, they're costly to treat, they take a lot of time. So you have a highly burdened individual already coming into your clinic. We also know that you are low resource providers, that you don't always have the staff and the infrastructure that you need. So combine the highly burdened patients with the not enough resources in your clinic. Those inadequate systems actually result in worse outcomes for your patient population that you serve, and that continues this burden cycle of how that patient step ends up on your door. And so we kind of understood that burden cycle. We discussed it, and we said, well, what can we do? Once we know about this burden cycle, how can we disrupt it? So, we were thinking, well, how can we disrupt the burden cycle? So you can take that down. We talked to the clinics, and we said, okay, number one thing that you all want to break that burden cycle is more staff and more funding and training for your staff. And so, as you know, Sostento has been focusing on that all year. We've delivered over $4 million for workforce funding. We provided trainings on data collection. We've done a lot of that work, and we will continue to do that work. We also understood that some of the tools and services that Sostento provides can help reduce health worker burnout. Our free rides that we provide by Uber Health to get patients so they are not late to an appointment, so they do not miss an appointment. That appointment they may not make because they don't have transportation. We've heard that from you, and so we know that free rides that can help improve your patient outcomes will help reduce your burnout. So we know that there are free rides. We have our helplines to help answer the calls that come in. We also do these webinars and monthly get-togethers so that health workers don't feel alone, and so you feel connected. So these are all things that we believe we can do at an even higher level next year for our health workers. So we knew that we wanted to disrupt this burden cycle, but we needed funding to do it. And that is what brought us to something very special that I'm excited to tell you a little bit about. We're going to talk a little bit later in the live event about how we are going to use art, and a very special type of art, to not only raise money, but to uplift all of you. And so we got some really amazing partners that we're going to meet together, and I want to show you what we've come up with. It's the Turnout for Burnout. So right now we are kicking this off with you, Turnout for Burnout. We're bringing people together to raise awareness, to talk about the burnout, so we're not isolated, and we're looking to create wellness through collective action. So we want to bring people together to talk about burnout, to take collective action. And so Sostento is leading this charge with a really unique charity called Endaoment, and we're going to have the Endaoment CEO on later to talk about their role in this partnership. And we're working with another group called Art Blocks, which is a art house that creates something called generative art, and we will be meeting the artist that is creating a really unique art series that will be sold to benefit all of you, the health workers that Sostento serves. So this is a little bit about the campaign. We're going to dig into it later. But what I want to do now is bring on the health workers from our network to talk about burnout. Usually we have the health worker roundtable at the second half of the stream, but we're going to bring them up first today. So I have three amazing frontline health workers that are so active in their community from Mississippi, Wisconsin, and Tennessee. They're representative of our network, amazing leaders. And after all we've gone through, they are still here with us. And I'm so proud of them. So let's bring them on so we can talk to these frontline health workers. Amazing. All right. So I have three of my favorite people here to talk about the subject of burnout, how we can fight it, how we can work through it, how it's felt. So what we're going to do is we're going to do a round of quick introductions, 2 minutes each. Tell me about your clinic. When I call you out, tell me about your clinic and the population that you serve. So we're going to start in Wisconsin with you, Sara Nichols from the Open Arms Free Clinic in Wisconsin. So Sara, please tell us a little about yourself and your clinic.
Thank you, Joe. Well, my name is Sara Nichols. Open Arms Free Clinic is celebrating its 10th anniversary this December of treating our first patient. We're located in Elkhorn, Wisconsin, serving all of Walworth County, which is in southeastern Wisconsin. Many people may know of the tourist area of Lake Geneva. Well, with all good tourist areas, we have a lot of essential workers who we serve. Our qualifications is no health insurance, low income at 200% of the federal poverty level, and again, living or working in Walworth County. serving as an executive director as an initial volunteer from the very beginning to now a paid employee and having 25 paid employees that we're able to support our 250 volunteers. We've been able to take care of 5,000 patients to date. And yeah, I'm still standing, but what keeps me up at night is that stable staffing to keep that foundational support. So it's been a journey.
Thank you, Sarah. You were part of our Web3 campaign last year, so you're not totally new to this. Let's go from our Sarah in Wisconsin to our Sarah in Tennessee. We have Sarah Wells I love the name of the clinic, Friends in Need. So Sarah, come please say hello and tell us a little about your clinic.
Thank you very much. Friends in Need is 27 years old. Just celebrated that anniversary, and we're very proud of that. Our medical department grew by 200% and is growing even greater now. We serve the uninsured, the underinsured, and getting ready to possibly go look at TennCare as a hybrid model clinic. We're needing to find some base support funds that would help us to do that. So I'm at the Rural Health, which I'm on the board of directors there, and we're having our conference right now. So this is some of the things we're going to be discussing among each other is how can we better serve our community. We do have primary care, women's health, and then dental care and dentures. Some of the greatest needs for us in our area is dental. No one seems to be able to get the dental care that they have need of. And then if you have TennCare, for those that are got that in April, there's no providers to take them. So right now we're looking at this is another population that if we don't step in, we'll have to do without, and that we see happening.
Well, thank you, Sarah. I know you in the middle of a conference joining us. We really appreciate it. And lastly, we're going to go over to Jackson, Mississippi, and Shantay Griffith from the Institute for the Advancement of Minority Health. Hi, Shantay. Good to see you. Please tell me a little about yourself and the institution you serve.
So the Institute for the Advancement of Minority Health is probably a baby amongst the other two. We've been in an establishment for 3 years now, and I am the Director of Community Engagement and Outreach. And so we do a lot of work out in the community to reduce health disparities across 82 counties. And so we are excited to participate in this call, and it's so interesting that we are a part of this because burnout is something that we definitely have dealt with in these 3 years, but we are very excited to continue to provide quality care to the individuals that we serve. And so some of the programs that we have is maternal health, we have tobacco cessation, we have COVID-19 awareness, we have just a host of programs and services that we provide, and all of these services are at no cost to the individuals that we service. So we're very excited to be able to provide these life-changing services across the state of Mississippi.
Thank you, Shantay. Yeah, I know all of you support free and charitable clinics. That's our main constituency, free and charitable clinics that exclusively serve families living below the poverty line, individuals that just fall through the cracks, that don't have, are underinsured, uninsured, and are often volunteer and donor driven. And so all your work is so amazing. But let's get into the conversation. Let's talk a little bit about how we're feeling right now around burnout. The pandemic has really created extreme burnout for my team at Sostento, so I'm sure for all of you on the front line as well. So I'm going to go around, and if each of you could talk a little bit about, how burnout has affected you and your team, now that we've kind of been through this whole COVID ordeal. So Sarah in Wisconsin, and Open Arms, I'll start with you to talk a little bit about how the impact has been at your clinic.
Well, certainly I'm a first responder in thinking. And so as soon as 2020 hit, I was the first to say we have to keep our doors open. And with all the volunteers that had to go home, keeping those few employees at the time standing was really, really hard. Keeping them safe, keeping them informed, giving them the tools and how to respond. Well, those are not the same staff that I'm standing with now. And actually, I looked at the last 3 years from 2020, 2021, and 2022, 72% of all the staff that I've hired have been in that time. And it's because of the turnover and the burnout of detachment of things outside of our control, family situations, the fear and anxieties, and just how to give direction when we don't know what tomorrow looks like. That doesn't work for everybody. And I certainly have felt it, so that so much of my time has been on trying to nurture a team environment. It's been difficult, but certainly what I've seen, I can get it. I can go to yoga and massage and walk my dog, but if I don't have tools to help maintain our mission-driven services, that's where I really struggled.
Yeah, I can really resonate with the uncertainty during the pandemic, and being a leader in a time of uncertainty is incredibly difficult. And one of the things that I find burnout does is it tells you that whatever you're doing isn't enough. I think that's one of the hardest parts about burnout. There's so much need in the communities that we serve. We do the most that we can with our staff, but there always is more need. And I feel like the burnout kind of doesn't let you celebrate the wins sometimes, so that you have continued to grow and bring in new people to keep your mission going is just incredible. So I appreciate you sharing that. How about you? We'll go to Sara in Tennessee now, Friends in Need. Tell me a little bit about the burnout that you have felt and your clinic has felt during the last 2 years.
Some of the things that is so hard was immediately our dentist, had to get up and leave us, because I started work on March the 2nd, 2020. Mm-hmm. And then the news came immediately the following week about shutdown for dental offices. And so it was emergency only. We had stayed with us. All of the ones that were volunteering left us. And they all said the same thing. This is not worth my children's health, my grandchildren's health. And I heard that over and over. I cannot take this home. And so having the loss of dentist and then all of our patients piling up, during that time, nobody could be seen unless so simply, giving antibiotics or pulling of teeth, and then watching others that could have saved teeth not being able to do so was very difficult, and difficult for the one dentist that stood by my side. In our primary care, we continue to open up and serve, because that's what we were and still are serving with the COVID is very dear to my heart. We have our mobile clinics that have gone out, really and watching how our nurses go out and they interact with the patients and trying to give them that peace and calm to know that it's all right to take the vaccines or, being tested, especially on the mobile unit, have to be tested before they can be in dental. And so doing so, and that has been for the full time since March of 2020. What I have watched in the burnout is, number one, I'm a minister, and two, you're supposed to be perfect. And then I'm a social worker, and you're not supposed to experience any kind of burnout. You're not supposed to have any kind of anxiety. And I've always been really calm. And now all of a sudden I'm not calm. I'm very emotional. And today, coming down the road to this conference, I cried all the way, letting it out yesterday, where we don't have enough money to operate on. And we just moved into a wonderful building. It's almost 12,000 square feet. We went from 3 like this because COVID and the tight areas, trying to make everything safe. My employees were just always on nerve, and then I went along with them. I've watched them as they quit smiling, they quit, would still have our lunches together, and I'd watch them sit there and have this sad, long face. It seemed like, there were so many family problems, fear of the COVID, and then getting past the fear, well, forget it. But the fact of it was, do I take families at home? So watching that, watching the emotional breakdown that all of us have had at one point, of tears everywhere, to after we moved on the 17th of October, are laughing for the first time since March of 2020. I'm hearing some laughter. I'm hearing and seeing some change. And then I still see a book, one of them, that I love dearly, asking for prayer because she's so overwhelmed. We have to remember we just moved primary care and dental care, and nobody knows where anything is. And then the struggle of money, and wanting to keep those doors open because we are growing and we're meeting needs. So I feel that, and I've had to admit that to others, and I've had to look them in the face and say, what you're going through. I'm hurting too. And this is one place where we can walk together, is that we're going to walk out of this into that sunshine, and we're going to make it. And actually, Joe, I don't think you know how much that you're being used for me, because I get down and I think, I got to call Joe. You are helping bring sunshine and light and hope. And Sostento is just absolutely my dearest to my heart. We got one of the first grants, and I thank you for it.
Well, you're very welcome. And, one of the things I talk about, one of the things I talk about is, with our health workers, with our team, is we got to put on a brave front. And sometimes that bravery is mistaken for we're not feeling things. But we know that service is what uplifts us, and that we are going to be a brave in front of our community and our coworkers and our patients. But we know that bottling up that burnout has its toll in those quiet moments when we're alone. So, Sarah, how much your team means to us and all the free and charitable clinics, and to know that you're growing just like we've grown during the toughest of times is a testament to your leadership, Sarah. So appreciate you sharing that. And Shantay, let's go to you. Please tell us a little bit. You've been in Jackson, Mississippi. You've had not only COVID, you've dealt with other things, water shortages, a whole bunch of different things. So how has it been for you in the community and burnout over there in Mississippi?
Absolutely. And Sarah, I'm a social worker as well. In grad school a couple of years ago, and end up finding out right at the cusp of COVID, I end up catching COVID myself. And so having to oversee a clinic and still being able to take care of the people that we serve, I actually had to stay home for over a month because I was very, very sick. And so when I came back, my plate was full. I could not stop. I still was, working from home, even though you don't feel good in this line of work, it's never a time that you actually turn off. And so I was on. And I remember one day coming home from work, I had just worked a 14-hour shift. And I went into my workout room. I started exercising a little bit, got up and could not feel my left side. And so I couldn't talk, and my face was disfigured and all of that. And so by the time I made it to my ex-husband and I told him that he needed to take me to the hospital, we ended up taking me to the hospital. He ended up taking me to the hospital, made it there, and everything was back to normal, believe it or not. And so they did MRIs, EKGs, and everything on me. And so they couldn't find anything. And so one of the things that the doctor asked me, he said, Shantay, what do you do for, what is your line of profession? And I told him, I said, I'm a social worker. I'm in grad school. I oversee this clinic. And he said, I need to tell you one word. And that one word was unplug. You cannot continue to be effective and efficient, plugged up in so many different outlets. And he, and that right there has really stuck with me. So now when I'm out and I am doing different things for the community, I make sure that when I come home, I totally unplug. And so I'm very grateful to be on this call today. I think that every single thing happened for a reason. Thank you so much, JoJo. You are amazing. And Sostento has been incredible to the Institute for these free and charitable clinics. And so I am elated to be a part of this panel. And hopefully there'll be something that I can say or we can say that will be able to help people that are part of this call. Open Arms Free Clinic is amazing as well, because I did a huge program last week and the state of Mississippi, the Open Arms in Mississippi was there providing quality healthcare services. And I just see how we're actually combining and connecting in so many different ways. And so it's just a blessing to be a part of this call.
Thank you, Shantay. I think you each kind of gave a unique perspective on burnout, but it all just resonates with me. And you really, to know that we can do something for all of you and the hard work that you do. You're our muse at Sostento. That's what we say. We say the frontline health workers are our muse, the one that inspires us every day. So let's talk a little bit more about the cause and effect of burnout, and then we'll get to addressing burnout, what we can do about it. And one of the things that I learned that I wanted to share with our audience is about why it's difficult to deal with burnout and the difference between, a superficial dealing of burnout and what is meaningful that you think we can do to help your clinic deal with burnout. So we'll go back around. We'll go to open arms. Sara, to you first about, talking about why is it so difficult to deal with burnout and some of the differences of superficially why a day off or a massage won't do it for you, and what really you feel is the root cause of the burnout. So Sara, I'll go with you first.
Gosh, I wish I was third so I had time to listen to all you guys, because I wanted to chime in all of this, because it is this network that has been my saving grace for me personally. And I think it's difficult to face burnout is because nobody in the history of our, collective action of our parents or our grandparents ever had this worldwide pandemic like this. We haven't seen it modeled. And in America, we're so forced to work. Your work determines your progress, and you get success by working hard. And so you work through being sick, and we never had a wellness mindset. And I think, where I had struggles and still do is giving yourself grace and pause to unplug, like Shantay said. I watched my husband not take a break, and he is pulling away from the family because he's just so overwhelmed and has no more tools. And when people, and my turnover of my staff, in fact, Sara, I've been crying all day too, because I had another staff person who's only been here for 6 months who resigned this morning, and she was amazing. And I had in my next budget year her raise and her promotion, and I couldn't even say this out loud to keep her, because she's so burnt. She went from one health system, fleeing that, to a free care, thinking this is going to be more compassionate, but it's still patient care. And and patient care, as Joe said, those low resource populations, our criteria for our income for our medical services, our dental services, our behavioral health services are so that we serve that middle. They make the working poor. They make too much for the state insurance programs, but not enough to buy their own marketplace plans. But here, a woman who has already identified as potentially with breast cancer, and we can't get her free mammogram. And so she's like, that was the last straw. I can't handle patient care when I can't help my people. And but she was already so burnt out before she even came to us 6 months ago, because of the health system that she was fleeing, and never gave herself even a couple weeks to detox, to find her center, to find her grounding, to find what she believes in. She hasn't been gentle enough on herself because she fiscally needs to have a paycheck. You need to work because everybody's losing their homes or their cars, or the eggs are $4 at Aldi's. People need to work. And so we're in this mindset of this is why we can't face burnout. You don't get to, the bills still add up. And I don't, yes, there's a lot of system things that I want to change and want to punch every health system. I'm sorry, I have a lot of great partners. They're good partners. But why we can't get a mammogram for just anybody who needs it? They have to have all these criteria. And that is this part of what I just learned from Dr. Christine Grady when she was talking about moral distress. It's available in the world of opportunities, but we have so many people that we're caring for that don't have those opportunities. And our employees are just like a hair away from our patient. And so they feel it so acutely, and it's hard to detach when you're already so emotionally drained. So I think it's difficult to face burnout because our culture doesn't allow for paid sabbaticals. Our culture doesn't allow for, here is a bonus, to get you that space to be healthy and well.
Sara, what that reminds me of something that I find about burnout is it feels like it's our fault. Like there's
Oh,
something that we
100%.
did that we aren't doing, and that's why we're in the burnout situation. And I, when I hear you talk, I just kept thinking about that, it wasn't your fault that that person couldn't get the mammogram. It wasn't your fault that that person quit. But when you're burnt out, sometimes I say you can't go to sleep because you're thinking about things. And then you can't get up in the morning because you're so tired, and it just feels like, what am I not doing right?
And it's exactly that feeling of a yoke holding on to all of the burden, and you're just carrying it, and it's getting heavier and heavier. And I mean, I talk to my chiropractor all the time. Can you just take care of the yoke that I'm carrying right here? And
Absolutely.
Yeah, it's heavy.
Thank you, Sarah. So let's go to back to friends in need. Sarah, why do you think it's so difficult for us to address burnout, and anything of what you think the difference between superficial dealing with burnout and what meaningful burnout reduction looks like?
One of the things that I'm watching too, same as what Sarah is going through, is we, on the day that we made thing for us, and getting everybody ready. Before we left that day with the first load, my bookkeeper walks in and lays down his resignation, says, I know this is a bad time. He had no idea, because we moved that day and the computers weren't hooked up and I couldn't advertise, and didn't know that he had been going through burnout really badly. And we have found out how bad, and it's a mess. So now, he was not doing his work. He wasn't coming in on 1 day a week. So had cut himself back to 4 days because he, quote, didn't have work to do. And he'd not been doing any filing. Things have been piling up. And watching that employee who's missed in 5 months 303 hours, that's overwhelming. And if I try to talk to the person, they begin to cry and say, I'll just quit. There's no, the basis of even trying to address it, to talk things through, is not there, because they just want to quit and run. And I know that feeling. This past week, I took a whole week off, and the reason the spa doesn't work, because it doesn't reach the heart. And everything that we do is from the heart. And a spa would never go for me. I wouldn't lay down long enough for that. And another thing is that for me, what will make me feel better was we had a fundraiser, which went from the move. In 2 weeks, we went into a fundraiser. I thought I was going to die, but by the time we got through that, I was able to pay some bills that had to lay, which I don't let bills lay. From the time I came there, the day it arrives, that's the day it gets paid. I can't do that right now. And so that is causing me to look. And like you said, Joe, I'm looking at me. What have I done wrong? Why is it that I can't find the money? Where's this hidden barrel of money somewhere? So I went away to just rest for the week, and I couldn't, my mind wouldn't stop. And the night before I left to come back home, I didn't sleep, not one bit. And then I had physical health problems that kicked in. With my heart issue, I can't allow this place to close. I can't allow that the patients to not be able to be cared for. And the brokenness inside of my heart is, I don't know how to fix this. I need help. And that's where, having that we could talk and going to hear that I'm not the only one going through this. And so it must not be just me. And then some directions. Where do I go to find some physical help in order to being able to take the money from, we didn't make a lot of money, but I was able to pay $12,000 in bills. I had my payroll, and I could go away for a week and not be fearful of how's the money going to come in? What am I going to do? I mean, that's the way I'm living since May. Every dime comes in. Is it enough for the payroll? Because, and then with people quitting and having to start all over again, retrain, it's enough to make you, scream. And then I see it in each one of them. We gave a desk, and she busted out crying because she got the wrong desk, and she was asked to keep the wrong desk. And that just floored her. And, nobody heard her need. So we made sure we got the desk that was misplaced and put back where it belonged so she could come back to work and do that in peace and quiet and comfort in familiar grounds. It's looking to see what they have need of and not try to talk them into hearing I want to hear your point of view. I want you to help fix this. I need this to be done. So listening to my employees and letting them know, I hear you. What can I do to fix it? And then do everything that I can.
We hear you, Sara, and that you keep going, that you're there for your staff. I know that burden. That's the burden, right? When you're a leader and you're there for your staff, you're there for your community, and it feels like a heavy weight to carry. But being able to hear you talk about it and us carrying it together, I think that takes burnout out a little bit, its power away from us a little bit when we're able to talk about it and know that we're not alone. So let's talk a little bit, Shantay. I want to talk to you then about dealing with burnout. Can you tell me a little bit about how you deal with burnout and some things that you think we can do to help reduce burnout among our constituency of health workers?
Absolutely. So one of the things that I did was I had to look up the word burnout because I think that sometimes we get burnout confused with just being tired. And so when I went in and actually looked that word up, it says a chronic state of stress. And so in other words, this is something that has been festering over the years. And I use this analysis, it says a state of chronic stress. And I use this analysis as when you plant a tree and in the infancy stage of you planting that tree, you can go ahead and just root it up, when you first plant it. But after time, over years, what ends up happening is now it's developing root. And so what has happened is with this burnout, the stress is now developed root. And so we think, oh, I'm just tired. My body is aching. I can't get any sleep. This is just a part of who I am. But no, this is actually burnout in its defined moment. And so what we have to do is we have to have some type of balance. One of the things that I tell people is that you can't pour from an empty cup. And so even though we want to go out and do some amazing work in the community, we want to be able to serve everybody. We want to make lasting changes in the lives of the people that we serve. If our cup is not full, it's almost impossible to be effective and efficient. So one thing that I look at as it relates to burnout is the importance of having balance. We must have balance in order to be able to be effective in our approach, especially in the scope of work that we do. And so we understand one thing is that we can't be all things to all people. And I think working in the nonprofit sector, we have tried to do that, and it is almost impossible. And so I say not to recreate the wheel, but let's see who's moving and get on board. And so for me, that's exactly what I do. I see what's effective, was evidence-based. So I really want to make a change. So, and one thing that I also notice is that we do a lot of good programs, but sometimes those programs are not evidence-based. So we're just doing good, happy work. And so when we start really being intentional about the services that we provide, then now we know that we're really making a difference in the lives of the people that we serve. And then, Sara, Ms. Wells, you mentioned something about having this in your heart. This is something that you just can't have it in your mind. It's not about a feeling. It's actually about this work being in your heart. And when it's really in your heart and you know that this is in tune with your purpose and your calling, now you can be able to walk this thing out and say, you know what, this is really not work. So for me, like in the state that I'm in now, you guys see me smiling and everything, I'm at a level of peace. And I have not always been there. We had a conference of a month ago, and I think I briefly mentioned it to you, Joe, that I was going to this conference. And this conference was solely self-care. Never participated in anything like this before in my life. When we came out the airport and came to the hotel room, they had massage tables. They had all these things that was actually put us in a relaxed state. And so one of the questions that they asked us, they asked a lot of questions. They said, well, how many of you guys have stress? I want you to get over this side of the room. And they said, for those that don't have any stress, I need you to get over to this side. It was probably like 3 people on the side of the room with me. And I felt bad, but I remember being stressed at some point. I remember being burnt out. I remember having all these ailments that come along with being burnt out. But today I can actually stand boldly with a smile on my face and saying that I have been intentional about this journey that I'm on. And so I am, I'm excited about what's to come. I'm excited now about serving the people. And now I can actually really serve them in a spirit of excellence.
Oh, Shantay, well said. And I guess maybe that leads to, maybe I'll talk a little bit about what Sostento wants to do to get more health workers to where Shantay is at. And then we'll finish by going to the two Saras to talk about, what you're optimistic about. Because I think, Shantay, you've kind of laid that groundwork for us before we have to go on to our next, session. So let's bring up what Sostento sees as our way that we want to work into next year with all of you, with our frontline health workers, to disrupt the burden cycle. And we're calling it Sostento's Hope Cycle. And how that starts is delivering. It starts with listening. I think that is a core value that anyone who's worked with Sostento knows, that we're going to listen to the needs of the health workers, and we're going to find out what are the support and resources that you all need. What are the most timely support and resources that you all need? I remember it was about 3 months ago, it was PPE. So we went out, we got a delivery of PPE out to the network. So we want to get support and resources. Then we want to build infrastructure and capacity at our clinics. Because if we can get them the support and resources and infrastructure and capacity to implement them, we are starting in the right direction. We also believe that efficiency and effectiveness, it's not just about giving health workers the support, the resource, and the capacity, but you need to give them the training. You have to give them the things that they need to be efficient and effective. I see way too many things where it's the wrong thing for the right reasons. The intention is right. They want to give support. They want to give capacity. But if you don't realize that health workers have no time in the day to do anything new until we get them more effective and efficient of what they're already doing, then we're not going to make progress. So we believe that through that support, the infrastructure capacity building, and the efficiency and effectiveness, we can improve the health outcomes. And if we can improve the health outcomes in our communities, then we can start to think about what is the next layer of support and resources we can give to our health workers. And I can tell you this, I know Sara and Shantay, you both experienced this. Our free rides is a great example. If we give you that support and resource, you can get free rides to people that lack transportation. We build your capacity and your efficiency in doing it. You're seeing better outcomes with your health worker, with your patients. Then we can bring in even more support and resources to you. This is a little bit about how we're viewing it. And so we need to go on to our next session, but I want to close with each of you. We'll give you each 30 seconds about, despite all the hard things that we've talked about, what keeps you moving forward with hope. All right. So actually, we'll go reverse order on this, Shantay. You were just talking, you were just bringing the energy. Start off us without like a 30 seconds or less. What still gives you hope, even given everything we've gone through?
The people that I serve. The people that I serve is what gives me hope, because they're so resilient. And so that allows me to keep pushing on and continue to provide that quality care to those people.
All right. Friends in need. Sara, what still gives you hope today?
Well, I'm especially blessed, and I'm sitting here counting my blessings. I can get free mammograms. We do have a grant for this, and we're able to even do the surgery if they find a tumor or something, for early detection of cancer. It's being able to see lives changed and saved and given a chance to keep going on. And so that's why I will keep going on too.
Thank you. And we'll finish with you, Sara, in up there in Wisconsin. Tell us what still gives you hope today.
I think it's the fact that we're having these courageous conversations about how we're really feeling, and by level setting those conversations so that we can be creative again. It was our creativity that allowed us to deliver the services that we are doing right now. And that flexibility, more foundations are considering that non-restricted general operations kind of giving, so that we can be flexible. It doesn't have to buy blood pressure cuffs. It can be, what do you need to deliver your mission? And so we can be creative again in that space. And that has really given me hope for this next chapter.
Thank you, Sara. Well, this was such a heartfelt discussion. So I think that's one of the things I wrote down, Sara, but what you said is that if the mind is the one that creates the burnout, maybe it's the heart and listening more to our heart that can help us deal with that burnout. So I appreciate all of your time for out of your busy day for coming on. You know, Sostento will continue to serve you. You representing our clinic network. Thank you for talking about burnout with us today. So thank you very much to all three of you.
Thank you, Joe.
Thank you, Joe.
God bless you.
Thank you. All right, so we are going to go now into a short intermission, but stick around because when we come back in 5 minutes, we're going to be talking about how we are going to work to raise the resources that we need to deliver that hope cycle to our frontline health workers. So grab a drink. You can use the bathroom. We are going to have a short video with some more of our health workers. And if you want in the chat, we want to know, what do you do to fight your burnout? When you're feeling down, when you're feeling the burnt out, what do you do? So put that in the chat and we'll share it. On the other side, we'll be talking to our partners in our Turnout for Burnout campaign.
Healthcare work can be emotionally, physically, and spiritually exhausting under the best circumstances. Every day we are bombarded by human illness and sadness in our work. The pandemic has added layers of physical and emotional weight to our jobs. And in the world of charitable clinics, we are not working under the best of circumstances. Charitable clinics have been described as clinics of last resort. They are where patients go when they can't go anywhere else except for perhaps an emergency room. And the patients come with complicated health problems that have been neglected due to lack of access to health care, or they come having experienced trauma. It is easy for my staff to feel helpless and overwhelmed, but we do our best, often with a small, overworked staff, to provide excellent care and words of encouragement to help them.
Yeah, burnout in healthcare, we know, especially since COVID, has been really high, but particularly in the free clinic realm, the type of work we do is very mission driven, and the people who work in our free clinics are very compassionate. And so we see them pouring a lot of that passion into serving the populations and the communities, but not necessarily themselves. And so because of that, even now as we're coming out of the last bit of COVID, we're seeing a lot more of our staff who are suffering from burnout. They may not know that's the word for it, but even mood changes, depression, apathy, and struggling to focus on the work. And we know that that's due to burnout and just the type of compassion that's required. And they haven't been able to focus on themselves because nonprofits don't traditionally focus on ourselves, we're focused on the community.
I would say actually a lot of what you do as an organization, where having the classes that you, like classes or webinars or educational things that you put out, helping us identify the burnout and giving us ideas on how to address it, have helped me in the past as a leader to implement those things, which has been extremely helpful. I would say too, maybe in some funds for that kind of thing, because it's outside your mission, in the sense of money for lunch. When we've gone out and we're using it, we're paying it out of our own pocket to go out to lunch with each other, to have maybe some funds to do more staff development or relationship building things.
I guess that my experience is living in a rural community to where the poverty level is very, very high. And my staff is not making the salaries that they need to make to work for us. And they provide excellent medical care. They have excellent customer service. And I would hope that in the future I could give them a raise. But right at this time, I cannot do that because of the budget. But I think that when you can provide financial incentives for them, that makes them feel that they are worthy. And when you do that, they understand that they are appreciated and respected in their jobs.
All right, welcome back. I'm going to do a little more shout outs before we get going. I see a lot of awesome comments. We got Shelby, one of our other partners. Well said, ladies. I agree. The panel was so amazing today, the roundtable. I see that we have more of our partners in Tennessee, from an interfaith clinic in Knoxville, Tennessee. Ruth is here with the Bradley Free Clinic that is in Virginia. Rachel, one of our good friends over there in Wise, Virginia. Every time I speak, I motivate you. All right, Rachel, keep it up. Thanks for that. I also see that we have some of our staff here. Jennifer, our Chief Operating Officer, is inspired by all the stories. Our Director of Partnerships, Emily, is here, is inspired. We have our State Association of Texas, the Texas Association of Charitable Clinics. We are also grateful to have you in our network. We have some comments also about burnout here. Ratika, one of our staff members, talks about spending time with family and friends, remembering what's most important, as well as the Indocina Foundation. Talks about prioritizing yourself. You only have a certain amount of time in the day. What's optional? What's mandatory? Sometimes, you can put yourself first and say what's optional. So thank you for all of those comments. Now I want to talk a little bit more about this campaign that we are running, which is focused on raising awareness and funds to help address health worker burnout. We found a really amazing partner to do this with. Last year, Sostento worked with a community that is sometimes called the Web3 community. What I describe the Web3 community as something that kind of bonds them together is they all use the blockchain technology. Some of our clinics may have heard of the blockchain technology before. Maybe you haven't. But blockchain is a way to increase accountability and transparency. And there's all kind of utility that the blockchain can be used for. And there are communities that are coming around and kind of creating all kinds of amazing things with the blockchain. So last year, we raised over $130,000 with the Web3 community in a campaign where we did a charity auction of NFTs, non-fungible tokens. And so this year, we looked for a new partner that we really felt vibed with the burnout theme. And so we found an amazing partner called Endaoment, and we're going to meet the CEO in just a minute. And we came up with a project to release a series of art on the blockchain that is created through computer coding. It's called generative art. So it's a very special, unique, innovative type of art. And I know it all might sound foreign, but we're going to talk about it so you understand who we're working with in the campaign that we're running. So in a minute, I'm going to bring out our CEO from Endaoment, Robbie Heegar. But first, we're going to play you a little video that our team made as like our love letter to the Web3 community, asking for their partnership. So let's play our little 1-minute video, and then we'll have Robbie on to talk with him. All right, well, let's bring on Robbie, and we are going to learn a little bit more about Endaoment and how they are helping us with this campaign. Hello, Robbie. How are you doing? Welcome.
Oh, man, I'm good. Such an honor to be here. So thanks for having me, Joe.
Absolutely, Robbie. Well, let's get started with just learning a little bit about you and your organization. Endaoment is also a 501c3 organization. You've raised over $50 million for charitable causes. It's a real deal. So tell me a little bit about yourself and about Endaoment and how it got started.
Yeah, so I am a self-taught engineer and really Endaoment was my first project after learning how to code. And what we do at Endaoment is we're a nonprofit public benefit corporation, serving as a community foundation. And so you guys might be familiar with community foundations. There are hundreds, if not thousands of them around the country. And what they do is they help provide certain communities with philanthropic financial services. And we at Endaoment do something similar, but for a very specific community. We do it for the crypto community. So we help people who have cryptocurrency or digital assets, whether that's digital art or digital tokens or Bitcoin or Ethereum or you name it. If it's got a liquid market, we'll take it and we turn it into dollars. And we work with our donors to help find a place for those dollars to live as grants from Endaoment to other nonprofits. So we've granted out to nearly 500 different organizations over the last 2 years. We have nearly 1,000 organizations onboarded to the platform, and we support donations to really any 501c3 in the country. So if you're interested in connecting with crypto donors, I really highly recommend that you go and check out endaoment.org, spelled as you see next to my name with a DAO instead of a DOW. And that DAO misspell actually has some meaning to it as well, which DAO stands for Decentralized Autonomous Organization. And so what that refers to is the way in which we use blockchain technology to manage our grant making. So we use blockchain technology and specifically smart contracts, which are basically code on the blockchain, to manage the grant making process for donors to Endaoment in a way that really requires almost no centralized input at all in order to get funds from a crypto asset into dollars and then into the bank account of the organization that the donor wants to contribute to.
Well, thank you for a little bit of that background, Robbie. And, for me, at the end of the day, the impact speaks for itself. You've raised over $50 million for different charities across the country. You kind of take what some of us, probably from our side, think is magical internet money, and you turn it into actual cash donations for nonprofits. Maybe you could just talk a little bit about your most successful campaigns that you've done with other, charitable causes.
Amazing. Yeah, you're not alone in thinking of it as magic internet money. In fact, I, to this day, still refer to it as magic internet money. And sometimes it can be confusing for me as well, as somebody who's enmeshed themselves in this space. And a lot of what we're trying to do at Endaoment is create these connective moments where people aren't just engrossed in the magic internet money, but they're thinking about how it can have a real impact on their community and on the organizations that they care about. And one example that I really love to talk about is this fundraiser that we did in conjunction with a couple of different people. And you'll have to excuse, I live in New York where there are sirens.
You're good. We can hear you good.
Constantly,
your audio is
the
good.
healthcare workers are hard at work, as
Yes.
we can see. We did this program last year called Stand with Asians. And it was during the increased violence towards the Asian American, the AAPI community across the United States, which was just horrible and totally unprovoked and unnecessary. And so it was actually our first NFT-based fundraiser. And what happened was an artist named People Pleaser made a video for a client. And that client was a crypto company. And the crypto company said, okay, we're going to immortalize this video by putting it on chain as a piece of digital artwork, of non-fungible digital artwork. So like a one of one, like you can only have this one copy of the video. And they sold it and gave all the proceeds to this community fund at Endaoment. And so that auction at the height of the market raised $750,000 for this upstart nonprofit called Stand with Asians. And Stand with Asians is not so dissimilar as far as like where they are in their journey from Sostento, like a young, small nonprofit that is trying to reach scale and is trying to think innovatively about how they engage with fundraising and how they engage with technology. And And what they were able to do with that $750,000 is make a series of individual $25,000 grants to different small independent nonprofits across the country that were doing great work to increase safety and security for the AAPI community. And it really rhymes with what we're doing here with Turnout for Burnout, which is we are using digital art, digital collectibles to amass capital and put it into the hands of a high leverage nonprofit like Sostento to turn it into meaningful impact for a broad range of small nonprofits across the country that are providing critical services to a community in need. And that's part of the formula that we've found at Endaoment that really connects some of these things that feel like esoteric magic internet money to the ground level of I'm a person who likes magic internet money. I live in this community. I would like to give some of it to a organization that I love and care about to help make that money feel more real to me and to make that technological barrier to entry to bring that barrier down to the ground for a nonprofit that otherwise wouldn't have any exposure to Web3. And so that's what's so exciting about our work. And, you know, I really resonate with everyone who was talking about being mission driven and just like how that can contribute to burnout, because like we're really mission driven here at Endaoment. And there's just so much about the way that, you know, the three women who were with you before we're talking about burnout that I really resonate with, and, you know, excited to talk more about that.
Robbie, let me follow up on that because that's why one of the reasons we decided to, you know, engage with you on the campaign is not you're an educator about this space. You're my Sherpa working, you know, on understanding the space, but you also helped me understand that burnout is also common among the Web3 community. And so we felt like that's why the theme really vibed and those discussions were interesting. So maybe you could just briefly talk about, you know, why is there burnout also in that kind of community that's been working on the blockchain technology and the cryptocurrency space? Why is there burnout there as well?
There's so many reasons why burnout is prevalent in the crypto space, but chief among them, I think, is the fact that these markets never close. So if you are engrossed and enmeshed in the progress of these markets, you can literally never go to sleep and become chronically fatigued. And that's like the easiest way to do it. But also, this is a very passionate group of people who are moving at the speed of light, right? Like this space moves so fast. And so you can feel so much pressure as a professional in this space to keep up with everything that's happening across the board. And because it's a global movement of engineers and investors who are working on this technology, there's no shortage of people who are awake and working at any time during the day. And I think all of those factors, the fact that it's always on, the fact that it's moving so fast, that it's financially very competitive, and that it's sort of theoretically or intellectually very competitive, can lead people to do what we call falling down the crypto rabbit hole. And that's when you can't even pull yourself out of the space for a minute and get perspective on the fact that, you know, like, most of the world doesn't know or frankly very much care about the magic internet money, you know, and it's so important to, there's this meme, there's this, you know, like movement going through the Web3 space that has to do with burnout. And it's just two words. It says touch grass, and people will just tweet touch grass. And people have made hats that say touch grass. And what it's to say is that, like, too many people are spending too much of their time just glued to their computer screen trying to stay up to date with everything. And really what you need to do in order to keep yourself sane in this space is go outside, touch grass, walk around. You know, like, there's really great science about the number one cure to depression is going for a walk once a day outside for 10 minutes. And so many people in this space are just can really grind their gears down. And especially in the NFT space where things have been moving so fast and they've been going through a real boom bust cycle. And so when you're riding the boom, you can ride the boom all the way, as hard as you want for as long as you want. And then the bust comes and all of a sudden now you're committed. You're trying to salvage something that's completely out of your control. And that's where the burnout comes in if it hasn't already come in. And so I think this is something that I know my team feels. I know my friends who are in this space feel. But I also know that when we get the perspective and we see the world through a lens that isn't so focused on crypto, that we're able to kind of step outside of that burnout and be reminded of what's important. And I think that's what's so cool about this initiative, is that in working with you, Joe, every time we work together, I'm reminded of how sort of relatively insignificant my burnout is compared to people who are on year 3 of dealing with a global pandemic in nonprofit community healthcare centers, and that perspective really helps me own my burnout and take a step back and say, you know what, maybe this isn't as important that I get this done right now, or that I stay up all night watching this ticker, or,
Well, the resonance I saw between kind of the Web3 and the health workers is this idea of you can't stop. Like there's no off button, is that we don't have the off button. I can tell you at Sostento, growing this organization, I don't have an off button. It doesn't matter if I get an email from one of my health workers at 11 at night and they need something, I'm going to do it. If I have a proposal due the next day to get funding for my health workers, and I'm going to be working Saturday and Sunday again. But I love the kind of touch grass. Is that maybe that's something we can unite together on, is that, we need to find ways to realize that we are enough, that we can't see it as our own, problem, and that kind of unite. The one thing that I do say when I work with you, Robbie, and I work with people in the Web3 community, is that you uplift. There's something fun about the work that you do. So while ours is more serious, getting to engage with someone like you and getting to learn more about this artwork, and we're going to have the artist on in a minute, it gives us a moment break from our day of really serious stuff. So similarly how maybe you experience the seriousness, we actually want some of the lightness and the fun. So you definitely bring that. So my last question for you, because then we're going to bring on the artist. So what do you want our health workers, the folks that are here, maybe that first time being experienced with this, what should they know about crypto philanthropy, about endowment into the future? What should they know?
When we talk to nonprofit organizations, almost every single one of them says, how can we connect with the next generation? And how can we find the next generation of donors? How can we push our donor space into a younger demographic? And something that I think is really important to me as a donor and to our community of donors is that organizations show a willingness to experiment and try new things with new technology, and that they don't buy into the skepticism, even though there's so much sensationalist media out there about, the downfalls of crypto, and especially over the last week, there are so many ways to engage with internet-enabled ownership, which is really what crypto is. The blockchain is this very jargony term. Web3 is another very jargony term. Crypto is a pretty jargony term. What we're talking about is creating a system for ownership that's powered by the internet. And when you think about all of the ways in which nonprofits fundraise, sometimes you give somebody something that they take ownership of, like a little memento that they take home with them to keep, or you have a silent auction to raise money for things. And the world of crypto is almost no different than that. It's only different in that these items that you're auctioning away are digital and not physical. And there's a whole community of people out there who really want to leverage the impact that fundraising for a nonprofit can have as a means by which to show the world the valuable use case of this technology. And so we're just really excited to be right at that forefront. This is the first application of the generative art platform that we're using for solely charitable purposes. And just kudos to Sostento for coming to the table with that spirit of experimentation, with that spirit of, this is something new and exciting that gives us access to a new donor cohort that we otherwise wouldn't really have access to. And so I would encourage all of these listeners today who run nonprofit community health clinics to really think about, like, how could we experiment with and just try to find a path towards interacting with the crypto community, because I think it's full of really exciting new tools. And at a minimum, Endaoment has made it really easy for you to fundraise with crypto. Just the number one thing you should never do is turn away a crypto donor. And so if you have a crypto donor, just say yes, and we will help you figure out how to get that gift in the house.
Thank you, Rob. That's a great last one to end on. And Sostento is doing that as an umbrella, I think, for first experience for all of our clinics. So we'll be the go-to. We can answer some questions. Our team is starting to become experts here. But I would say that I do believe that if you want to tap into the young future donor, the future philanthropist that maybe has not been tapped by the large institutions that are slower moving, it's a really great space to explore. And Robbie, you've educated us today. You continue to be my guide into this new space with all kinds of surprises that they have. And I want to thank you for coming on. For all the hard work that your team has done for this campaign for Sostento.
And I'm so excited for you guys to meet Ryan Green, who has made this beautiful, beautiful art that you can check out at turnoutforburnout.com. So I will be quiet and give you the floor back, Joe. But I really encourage everyone to go check out this beautiful piece of art that Ryan has built out of code. It's so cool. It's really something special. And the fact that it's just numbers and bits, that's creating this feeling of like a warm sunrise or sunset that feels like a hug in digital form. Like the more you can share it with your communities, the higher the likelihood the success of this fundraiser will be. And we just really appreciate all you being here today and hearing about what we've been working on at Turnout for Burnout.
Thank you, Robbie. We're looking forward to more collaboration in the future, more cool things to do together. Thanks for coming on and educating us and onboarding us a little bit into the space. Thanks, Robbie.
Right on.
All right. Well, we have one last guest, one that really touches my heart. Robbie's already, kind of promoted. Let's get to know our artist, who's really our philanthropist, our donor, who's supporting our health workers here. Let's bring on Ryan Green, a generative and immersive artist. Let's bring him on. Hey, Ryan.
Hey, Joe. How you doing?
I am doing well. Welcome. Sostento Live, our last guest of the year. It's a privilege to speak with you. And let's just get going with it. Tell us about your story, your connection to health workers. Let's just start there so our constituency can get to know you.
Well, this whole web stream has been an emotional roller coaster. Stirs up lots of memories. My journey in healthcare started about 20 years ago. I am also a self-taught coder, and back during the web boom, I got into programming and web design, and I landed at a dialysis company where I worked for 10 years. And I made clinical scheduling applications, reporting portals, corporate applications. I think I did physician noting, and all those different tools that all of you use to care for patients. And so, being in the dialysis clinic and doing rounds with physicians was always very sobering for how real it made the experience. But I never really considered myself like part of the system. Not until in 2010, when my third son, Joel, got sick. My wife, Amy, and I have 4 children, and 5 children. And Joel, our third son, got sick in 2010 with cancer. He had a aggressive brain cancer that we found when he was just after he turned 1 year old. And that ushered us into a different world, into that fishbowl of terminal cancer, and living in and out of the world of healthcare, and in and out of hospitals and clinic visits, and getting to know Joel's health team, his amazing doctor and nurses, and becoming friends with them, and sharing in all the hopes and disappointments of walking daily in this journey. And you know, I think one thing that COVID did in these last few years is it took a world that the rest of the world has, maybe you call it a benefit, but I'm not sure it's a benefit to avoid, right? Like the choices that you've made as frontline healthcare workers, and the events that happened to us as a family that walked through cancer, turned our heads and caused us to look at what's in front of us, you know, the need that's in front of us. And you all chose to stay, and while the rest of the world scrolls away. And so what I learned through this process of walking with Joel and my family through this is the love and compassion that you choose every day. And so, whereas the first 10 years of my career were in healthcare, kind of cocooned in the corporate side of things, the last 10 years have been a journey of hope and disappointment and grief and creativity. I spent, you know, while Joel was sick, I transitioned from being a programmer in the healthcare space to being a programmer in the video game space. And that seems like a weird jump, but it uses all the same skills. And in fact, all the skills that I was using as somebody who made corporate applications for a dialysis company is the same technology that I use to create the art that we're sharing with you today. And so this journey of creativity has been this journey of taking everything I've learned in healthcare, everything I've learned being a father, everything I've struggled with spiritually, everything I'm dealing with emotionally, and trying to funnel it into something beautiful. Because as artists, I started making art because I thought I had answers, and I realized very quickly that I had questions. And I think this space of creativity, of art, of making art with technology, allows us to kind of address what the world is and hopefully imagine something more beautiful in the midst of that daily choice to walk with compassion.
Thank you, Ryan. I mean, from the moment our team met you, we selected you based on your art. We said, this guy makes beautiful art. But getting to know you has been so inspirational. Let's bring up the art. Jason, if you're in the back, let's just take a look at the art. This is for the series that is being created for the health workers. It's called The Colors That Heal. And it's created through a process called minting. So minting is kind of the creation of this art through the code where it's put onto the blockchain. And what's kind of special about the blockchain is that then it's immutable. It exists, and you can prove ownership of it. And it's something different because it also allows you to connect more directly with the artists themselves. That, Ryan can mint this art for us and directly sell it to people that is going to benefit the health workers. It's an amazing experience. So, right, I had to show the art.
I appreciate
You got some samples for everybody, but maybe you can talk us through the collection. It's called The Colors That Heal.
Sure.
I couldn't wait. You see how, sometimes I'm impatient. I had to show the art because of how uplifting it is. Sometimes I look at them in the day, but tell us a little bit about the collection, Colors That Heal, what inspired it, and anything about your craft you can share with us.
Sure. Okay. I want to start with the technical side. So code lives kind of like, you store files on your file system on your computer, or store it on a shared drive on the internet. Blockchain is like a shared drive on the internet. And what I store there is the DNA to make the art. And so the DNA it encodes the instructions, and then it takes a seed. And that seed, with those instructions, generates the same piece of art every time. So even if all the images were to be destroyed, you could still regenerate that picture, that unique picture, again and again, just by using the seed and the DNA. And for one, I just find that to be a beautiful kind of metaphysical metaphor of life in creation. And it's the same way that I feel like in digital spaces, we craft these worlds. I craft worlds in video games or on the internet, and we instill these worlds with instructions for its own reality, and then we invite people into it, and we invite them to discover and enjoy what we've made. And so previously, this past 10 years, while we were going through this journey with Joel, as an artist, I was working in video games. And so I made a video game along with my wife and my business partner and my friends. And that game chronicled Joel's life and his battle with cancer. And that was called That Dragon Cancer. And it was what started, as a desire to have answers and share them with people, turned into a memorial of questions. And in the midst of that, it took form as kind of this poetic memoir. And the reason I bring that up is because when I was introduced to Sostento and to this opportunity with Endaoment, it immediately brought to mind those experiences in the hospital. And there was a poem that I wrote for the game. It's actually in the game. And it's something that I wrote back in 2013. And when I thought about what it would mean to make a piece of work to honor you and to honor the patient's journey, it brought this poem to mind. And would it be okay if I shared it? Okay.
We'd love to hear it, Ryan.
So the poem is called "The Colors That Heal," and it's kind of a cynical take on being kind of at the end of yourself in a hospital room. All right, pull it up here. The sunset looks pretty from here. The orange glow cast on the wall. Better than the muted colors of this hospital. I wonder why they choose blues and greens. They, the ones who choose the colors that heal. Green for life. Blue for comfort. Purple stripes to hide the stains. This chair is too small and sticks to my skin. I hate vinyl. I've spent a lot of time in those sticky vinyl chairs in children's hospitals. And while, moving at the speed of hospital time, spending a lot of time alone and spending a lot of time with healthcare workers, and in tough conversations, and in hopeful, defiant wins, or where we just, could show that maybe that healthcare worker was wrong, right? Because they expected something bad that didn't happen, and we're going to be the ones that come through it. And then to have the reality set in that maybe we're not the ones that are going to get through it, and still being face to face with those who told us that they are going to help us heal. And so, what you do is bold. It's courageous, even though I know it doesn't feel courageous. And it matters to my family, even when we don't get respite, even though we don't get remission. It matters that you show up every day and continue to show up for hundreds of Joels that you meet throughout your career, and the reason that you keep returning. So this piece of art, all this coming back to what the Colors That Heal is, it's kind of re-entering those rooms that I've been in the hospital, in our home, after the oxygen tanks are removed, and you have all of those unused IV flushes, heparin flushes that you just didn't use, and the empty box and the half full boxes of gloves and feeding tubes and all of that stuff, and just reflecting on those quiet spaces, right, where you might look through the door of a hospital and see one person grieving, or you might see another person comforting each other, or you might see an empty room with just the ephemera of the struggle that's gone on there. And so this is as you watch kind of each piece take shape, these are animated, and so you can watch them draw. I hope you'll start to kind of see the shadows, the phantoms, the memories written on the walls of these pieces, and that they'll help you reflect on the journey that you've been on so far. And so, yeah, that's where this comes from. It comes from sitting in hospital rooms for many days. And I hope that, I should say the thing that I've discovered in this whole process is that, we're on the same team. And I acknowledge that what you do is heroic, even though it doesn't feel heroic. And I appreciate you. So this work is something that I've been working on for the past, month and a half. And it's been a lot of work, but I'm hopeful that this will be a tool that you can use, Joe, to raise funds. And I'm excited that, something like this, something that's meaningful like this, can also help, serve my family as well. And so it's a partnership that made a lot of sense to me. And I just really thank you for the opportunity.
Thank you, Ryan, so much for sharing your journey with Joel with us through this art. I feel it when I look at it. It's not often that I look at a piece of art and I feel something, but you definitely have accomplished that. And so before we let you go, because I know we're a little over time here, I appreciate your time. Now, the journey we want to bring you on is that of being a philanthropist, of giving back in doing an act of charity. So I want to ask, from your point of view as an artist, as a member of that Web3 NFT community, what does it feel like to be able to use your art, your skills to give back?
Yeah, I think, those working in the Web3 community are no different than those working in healthcare or those working in various industries. We all want our work to have eternal meaning, right? We all want our work to last beyond the time that we leave this world. And so I look for, I'm grateful to have opportunities to make meaningful things. And that people would stop and find it valuable and say, like, oh, the thing that you created that's beautiful has value to me. And that's where I think, like, Web3 and all this hype and everything, it can get lost in all the bad headlines you read on Twitter and on the internet and you hear on TV. There's a lot of bad stuff that happens. And however, I see these pockets of people really wanting to make meaningful difference. And like, your guest said earlier, like, I can't be all things to all people. What can I be? Well, I'm an artist. And I'm going to look around and I'm going to see who's moving. Endaoment, Sostento, art blocks, they're moving. And so I'm going to get on board. And then I'm going to be creative. And hopefully my creativity can have impact. So that's why I'm here. That's why I choose to do this, even with all the uncertainty, even with the booms and busts. And so, yeah. Thank you.
Well, we got some comments here. We've got some love You got some love from Joshua, Ratika as well. How beautiful your art is. We've got Kate, one of our health workers, inspired, sending you love and encouragement. Jen, one of our staff members, about the beauty we created here. You got another Good Shepherd Clinic, one of our wonderful clinics in Georgia. Just touched like me, beautiful. This looks like someone from the Web3 community. Can't wait to see all the mints. And also Emily from our team, getting to know you. It has been such a joy. We hope to continue this relationship, right? We love to continue working with our partners who uplift us like you have today. So we'll let you go. I'm going to give the health workers and our network a little bit of how they can share the message about your artwork, how we can get them sold. But we appreciate the partnership. One thing maybe I would last say is, what makes for a good health worker or someone from my team is the ability to be authentic and vulnerable. That is something that I think is rare in our society, that we're supposed to be brave, we're supposed to put on the front, we're supposed to, do some things. But you have shown, and I think as well, that what unites you and the health workers we spoke to before, is that authentic vulnerability that you've brought today, and the ability to heal together when we don't bottle up and we share it.
Yeah,
so
when we're vulnerable, we're strong.
When we're vulnerable together, I think we can be strong. So Ryan, we'll let you go. We'll be promoting your art. I'm gonna tell all the details, but thank you for your time and for sharing a little bit about your journey with us today.
Thank you, Joe.
All right. Whew. Okay. Well, I'm emotionally spent. I don't know about all of you, but in a good way, not in a way where I've spent all day banging my head against the system, but a way where I feel like I've come together with people who are really meaningful to me and shared about a very important issue. So let's talk about what you all can do to help us in this fundraiser, in this end of year campaign. So I'm going to bring up two ways you can help. Number one, we have a social awareness campaign that will launch on Thursday. On your social media handles, you can use hashtag Turnout for Burnout, and we want you to share a link to the page where people can purchase Ryan's art. It's www.turnoutforburnout.com. We will be sending a social media package to all the clinics before the 17th, so you'll have everything you need to share. But really, it's about sharing your view on burnout, how you've experienced as a health worker, using the hashtag, and linking people to www.turnoutforburnout.com. There will be just under 250 pieces of Ryan's art available for our auction or for our minting event. It's a minting event this time. And so if you know somebody who is part of the Web3 community, someone who has talked about crypto and NFTs before, please send them to turnoutforburnout.com. That is where they can mint the artwork. And that is also beginning at November the 17th at, I think, around 4 p.m. It's going to be first come, first serve. 200, I think actually Endaoment has already generously purchased the first few pieces, and then we'll have around just more than 200 pieces available for purchase. It needs to be purchased in cryptocurrency. So we are looking for a way, potentially, if you have a clinic or you have someone that may want to buy it with a credit card, you can let us know and we can arrange that for you. But the sale is through cryptocurrency. So this is the two ways you can help: the social media share and getting people to come to the minting page on the 17th. And we will email you with more information about that. But I wanted to finish with one other slide here, talking about the impact we can make with cryptocurrency donations here at Sostento. We are making it our goal to raise 10 Ethereum per clinic in our network. That's 100 clinics. 10 Ethereum is around $10,000 per clinic. We think if we can invest $10,000 in burnout reduction at each clinic, that will make a difference. So our main goal, what we're trying to raise for each of our clinics, is that 10 Ethereum. What we can do with 1 Ethereum is 60 free rides for a clinic, for their staff, or there for patients who don't have access to transportation but needs to get access to their healthcare. We know that these free rides can help reduce a burden on a health worker. And so for 1 Ethereum, we can actually do 60 free rides. And then for just 0.5 Ethereum, which doesn't sound like a lot, right? Half an Ethereum, at current rates, we can actually provide PPE to a clinic for a year. So these are great ways for someone with cryptocurrency to get involved. They can mint any number of pieces. The pieces will cost around 0.2 Ethereum, which is around $250 a piece. And we all have just over 200 of them. We will also be looking for just general cryptocurrency donations and NFT donations as well from the community with the help of Robbie and the endowment team. But this is a little bit about the impact that we can make with some of those crypto donations. It's a little alternative, but this is a new donor base. It's, I think, just understanding their philanthropic abilities. And we've met someone like Ryan, who's an artist who really is connected to health workers and can help us raise this kind of funding for the work that frontline health workers do. So with that, I am going to be signing off. This is our last public Sostento Live of the year. We're going to be continuing to serve the health workers. We do have a special meeting just for you before the end of the year, but we will come back in 2023 with more Sostento Live. We've had really great feedback from our partners, from the health workers. So we will come back in 2023, and you can know that Sostento will be here through this campaign. We are committed to frontline health workers, in particular to all of our free and charitable clinics that we have been serving. You know, people might be turning away from the pandemic, but we are still here. We are going to be sharing more information about beyond COVID, beyond the pandemic, how we will be serving all of our free and charitable clinics. So know that Sostento is going to be here next year. We're going to continue to do these live sessions with our health workers, with our partners. And I want to just thank you all for joining me. You know, we're almost at over an hour and a half, and I see a lot of you are still here. So that's amazing. So in the meantime, go to turnoutforburnout.com. You can learn more about endowment. We'll share that as well, endowment.org, for, you know, groups that are interested, you know, to learn more about how they can get involved with accepting crypto and NFT donations. Robbie is such a great guide. He's got a great team there. We got to see Ryan. Yes, thank you, Ryan. We're so happy for you. And I see that we also have Ryan is here, as well as Boone, who was our top cryptocurrency donor last year, who supported our mission last year. So Boone, thank you for joining us. I know your wife is an ICU nurse. So thank you for coming and learning about what we got going on today. I see we got a health worker as well. Thank you, Shelby. You know, we love working with you. I got some of our staff as well. Ryan, calling out your art. Can't wait to see it. So with that, I think we can close out this last Sostento Live. Thank you for supporting Sostento. Thank you for being here with me today. I am going to sleep. Maybe I'll have some ice cream or something tonight. I think that's in order. That's how sometimes I'll deal with the end of the day, a long day. I hope whatever, you know, serves you, you continue to invest in yourself. You realize that for us to continue to serve our communities, we have to serve ourselves. So know that we're here, and thank you very much for joining us. And until next time, we'll see you later. Thank you.